Good day, everyone. This is Dr. Garcia, and I will be discussing about a healthy lifestyle. So, for this lecture, I will be discussing the factors that contribute to a healthy lifestyle, the social determinants that contribute to achieving a healthy lifestyle in any society, as well as lifestyle related diseases. So, what is a healthy lifestyle? So, if you see this infographic, there are a lot of words or concepts associated to a healthy lifestyle. So, none of these are wrong. You probably have some of your preconceived notions here on this particular infographic. But for the purposes of your medical school education, we will be defining healthy lifestyle as follows. So, according to Oxford, it's a lifestyle that includes activities and habits that encourage the development of the physical, mental, and spiritual fitness and is aimed at reducing the risk of major illnesses. According to the WHO, it is a way of living that lowers the risk of being seriously ill or dying early. It is a way of life that helps you enjoy more aspects of living, and it also helps your whole family. So in this picture, you can see some of the components of a healthy lifestyle, which are fitness and physical activity, healthy nutrition, regular measurements with relation to your overall well-being, regular physical examination, and relaxation. So these are the components. So of course, there's regular exercise or physical activity, a balanced and nutritious diet, attaining adequate sleep and relaxation, and abstinence from smoking and other non-essential drugs, and alcohol. Okay. Now, in your DPC review notes, you will note that we have defined the major components of lifestyle from the point of view of health. So, similar to what was mentioned in the previous slide, these are the 7 components we will be focusing on. So, one is physical fitness and exercise, second is dietary intake, and I will be lecturing also on particularly on diet and nutrition. We have alcohol intake, smoking, illicit drug use or addiction, sexual behavior, and spirituality or mental health. Now, for the first component of physical activity, it is defined as a bodily movement produced by skeletal muscles requiring the expenditure of energy. Now, this is very important in the aspect of lifestyle, or a healthy lifestyle for that matter, in that studies have shown that increased physical activity has been associated with a decreased risk of cardiovascular disease in particular, and it has been found to increase life expectancy. Now, it doesn't necessarily just encompass exercise or fitness activities as we know it. So, we have the 4 domains of physical activity here, which includes things that you normally do in a day. So, they're classified as um, occupational, or those activities that you do at work, especially if the job involves manual labor. Activities that involve you uh, going from point A to point B, or transportation. They also take into consideration, of course, some domestic tasks or housework. And of course, the more well-known or more popular aspect of physical activity, which is the leisurely or recreational activities such as your sports, etc. Now, in this particular survey done by the FNRI in 2008, okay, they looked at the physical activity and the prevalence of physical inactivity in Filipinos more than 20 years. So, there's quite a bit of difference in that in 2003, you see that uh, the non-occupational uh, aspects of physical activity are present, whereas in 2008, more on your physical activity shows that it's more on occupational, leisure activities, and transport related. Now, as you can see, for the females, doesn't necessarily change that much, as well for the males. No. So mostly physical activities are more for the things that we do in daily life. So as a means of measuring exercise or physical activity, we have what you call the FIT principle. So FIT is basically an acronym for frequency, intensity, and exercise time. So according to the WHO, sufficient exercise would be defined as an exercise of how often? 3 to 4 times a week, spread over the week. Intensity of moderate, which is indicated by the number of times the heart beats per minute, meaning the more intense the exercise or activity, the faster the heart rate. Later on, we'll show you how to compute for that. Now, for the exercise time, 10 to 15 minutes is enough, and then gradually increase to 30 minutes. So whenever you're trying to counsel a patient on the exercise component of lifestyle, it's important to follow the FIT principles. You should always specify the frequency, intensity, and the time so that your patients will be well guided as to how they're going to achieve enough physical activity. Now, as mentioned earlier, one of the measures of the intensity of the exercise is the target exercise heart rate. So these are the steps in doing that. So first, of course, you determine your resting heart rate. So you ask the patient to sit quietly, or you can try this on yourself. You sit quietly and then you count the number of heartbeats per minute. Now, to determine the maximal heart rate, basically you just subtract your age from 220. So 220 minus, insert your age here, and that's your maximal heart rate. Now, to determine the target exercise heart rate, there are important figures that you should remember. So, depending on the intensity that you want, um, will be it. You should compute it as follows. Okay, so if you want a moderate type of exercise, be around 50 to 70% of the maximum heart rate. So you get what you get your maximum heart rate, and then you multiply it by 50%, and that's how you get your target exercise heart rate. Okay, so any less would mean that your intensity of exercise is insufficient. More than the target exercise heart rate may be dangerous. Okay, now the recommendation for sufficient physical activity should be at least 30 minutes of regular moderate intensity physical activity spread over 5 days per week, which this has been found to reduce the risk of several major non-communicable diseases. Now let's go to the second component, which is your diet. Now when we say diet, it's basically pertaining to the amount of food we consume. Okay, so in determining the appropriate diet, we should take into consideration the age of your patient. The dietary requirements per age are different, and the purpose of your food may be different depending on how old you are. So for children, it's mainly for development and strengthening the immune system. For teens, you should be accounting for hormonal changes as they go to puberty. And for adults, basically maintaining good health. Now for the elderly, this is where it gets a bit tricky because most of our elderly, they would have comorbidities. So you should take into account their dietary needs. So there's not really a diet that's one size fits all. So it should be very specific and tailored to your patient. Now, other things to consider would be the condition of your patient, especially because there are certain conditions or stages that the body may go through which require certain requirements, such as pregnancy. Of course, you have to have increased calories because basically the mother is eating for two. And then specific vitamins and minerals, which are vital for the baby's development, should be given. One such thing would be folic acid, no, for the development of the brain of the baby. For immunocompromised patients, an example would be your cancer patients who are undergoing chemotherapy. More often than not, they have nutritional deficiencies depending on their treatment type. So you should give an adequate diet for that. Athletes, of course, with their increased workload and physical requirements, no, they also have a specific diet, okay, depending on the type of sport they have. And then, of course, you have those who have allergies. Okay, those with food allergies should be taken into consideration when you're designing a diet. Now, one of the guides in designing a proper diet would be the food pyramid. No? It has been updated several times, and the latest version would be as shown here in this slide. Okay, so if you notice, it's just not as simple as go, grow, and glow, but they've taken into account a lot of factors. So, of course, it's in a pyramid design, meaning uh, in terms of the amount that you should be partaking of each type of food. So, of course, for the beverages, you should have 8 glasses of water per day. So that's approximately 1.5 to 2 liters of water. Notice that it specifies water specifically, and you should avoid sugary drinks like your soft drinks and commercial fruit juices. Okay. Next up is rice products, more of your starch or your carbohydrates in this level, which requires 5 to 8 servings per day. The next tier should be your vegetables and your fruits, composed of 2 to 3 servings each. Okay. Milk products, you should just take about a glass a day. And then your eggs, for additional protein, if you want, you can just get one per day. And then your fish, meat, poultry, your protein sources are here. So about 3 to 4 servings per day. And then your sugary drinks and sweets are 5 to 8 teaspoons per day. Yes, you got it right. Teaspoons, not tablespoons, not glasses, not servings. And of course, your fats and oils, which also are measured in teaspoon, about 6 to 8 per day. So notice that basically the food pyramid is trying to tell us to regulate our sugar and fat consumption per day and focus on the necessary elements like your vegetables and protein and carbohydrates. Another guide you can also use, which is also found in your DPC review notes, is the Pinggang Pinoy. So basically, it's a visual representation of what your plate in a day would be. No, this is where your Go Grow Glow lessons back when you were in, I think, elementary or high school comes in. So it basically tells you how much you should be eating of each type of food. Now, if you look at your DPC review notes, you notice that it's divided, or rather, there are sections per age group. So again, there's no one diet that fits all. So depending on the age of your patient, uh, therein lies the differences of their pinggang. We also have the 10 kumain ments. Okay? So this is also a guide as to what is the proper nutrition that you should be eating. So uh, basically, it tells you to eat a variety of foods, specifically fruits and vegetables, high protein foods such as your fish, meat, and other protein sources. You should also have calcium-rich foods. You should salt and or iodized salt-enriched foods also. You should also have access, or you should drink lots of clean water, and ensure that your food is prepared properly to avoid any infections. It also emphasizes that you should avoid salty, oily, and too sweet foods. And it also tells you to be active, avoid smoking, maintain your weight. And a special number here is for the babies. No, it's encouraging exclusive breastfeeding up to 6 months of age, and then afterwards you start your complementary feeding. The next component of a healthy lifestyle is your alcohol intake. Now, the recommended amounts of alcohol prescribed per day are as follows. So you only have an allowance of a bottle of beer, a glass of wine, and a shot of hard liquor with these corresponding volumes. Uh, there should be particular emphasis that drinking more than the recommended amount is, of course, deleterious or detrimental to your health because it can cause accidents and injuries. This is because alcohol depresses some of your cognitive functions, so it may cause accidents and injuries, particularly car accidents or injuries related to your drinking behavior. Chronic effects would include heart disease, of course, your liver disease, stroke, myocardial infarction, and then of course your Wernicke-Korsakoff syndrome, which is basically a form of amnesia, which is due to a vitamin B12 deficiency brought about by alcohol dependence. Now, the AHA basically recommends that if you don't drink, don't start. But if you do drink, limit yourself to one drink for women, two drinks for men. Now, this is not based on the stronger sex principle, no? There's no such thing. So basically, it's because of our biology. So women, girls, ladies, unfortunately, we have less alcohol dehydrogenase in our bodies. So we metabolize only a small amount of alcohol in our system. Okay, the rest goes straight to your bloodstream. Okay, so we are more rapidly inebriated than the men. Next up for substance use is of course your smoking and your use of recreational or illicit drugs. Uh, as a basic principle, both are harmful to your health. So please, if you do not use, please do not. So same principle with the alcohol. If you don't take it, if you don't smoke, you don't take drugs, don't do it, don't start. Okay, particularly because regular use can lead to addiction. Aside from that, if you look at the news or the latest events, no, a lot of the drugs, a lot of the tobacco products, they have additives, no, that can basically change your biology. So some of the side effects or the adverse effects of smoking and illicit drug use are seen in this slide. Okay, so for smoking, there's heart disease, pulmonary disorders, specifically your chronic obstructive pulmonary disorder and your lung cancers. Buerger's disease is a type of disease of your vessels. Okay, and of course, your illicit drug use would cause a lot of heart problems as well as psychosis or behavioral disorders, but more importantly, the legal hang-ups. Okay, so this is a slide from the American Cancer Society, specifically on how smoking can cause damage throughout the body. Okay, and that according to statistics, 1 out of 2 of all smokers will die from a smoking-related illness. So as you can see here, it's not just your lungs, but actually your whole body that is affected. Not just by the nicotine in the cigarette, but a lot of the additives in there as well. Next component is sexual behavior. So this is very straightforward, no? So you should be responsible. Everyone here is adults, I assume. Okay? So abstinence is still the best option. And if not, monogamy is the way. Okay? And please always use your protection. Okay? As we all know, unprotected sexual activity or promiscuity would lead to a lot of diseases, specifically those sexually transmitted infections, as well as hepatitis B and other such infectious diseases. Lastly, we have spirituality and mental health. Now, this is often an overlooked, but is an essential component of one's overall well-being. Basically, we've seen that it contributes to productivity, social interactions, and of course, your mental state, your psychological state often has somatic effects as well. Okay, so here in the Philippines, we have the RA 11036 or the Philippine Mental Health Act, which stresses the importance of providing medical health services for all Filipinos. So basically, it gives importance to everyone's mental health. So what are the contributing factors to achieving and maintaining a healthy lifestyle? So first and foremost is what we're doing here, health education or health promotion. So by sharing information on how to achieve a healthy lifestyle, we basically are arming our patients, we are arming you, our students, uh, in the fight against some of our lifestyle related diseases, which are highly preventable. Through education, we are also able to correct a lot of misinformation, especially with the internet nowadays. Now, on a grander scale, there should also be policy making. Okay, so creation of programs across social sectors and administrative regulatory practices are also a key contributor to achieving a healthy lifestyle in a society. So we also need the government's help as well. Urban planning is also a good contributor in that public spaces that encourage physical activity are key. Okay, so lately, since the pandemic, they already have instituted bike lanes, and back in the day, I think there are a lot of parks that allow group activities for physical activity. Okay, so awareness raising from civic or interest groups is also a contributor, which entails maximizing media and social media platforms. So you see a lot of vlogs on healthy lifestyle, etc. So now we go to the lifestyle related diseases. So first are the non-communicable diseases. So these are some of the common ones that we are faced, especially here in the Philippines. First is your cardiovascular and endocrine, which are your hypertension, diabetes type 2, and your metabolic syndrome. Now, your metabolic syndrome is basically defined as by the National Cholesterol Education Program as a patient who has three or more of the criteria they set, which is a waist circumference over 40 inches for men or 35 inches for women, a blood pressure above 130 over 85, a high triglyceride level, a low fasting HDL level, and a high fasting blood sugar level. Okay, so we won't go into the details of that. Don't you worry. I just wanted to let you know what it's about, especially for those who are hearing this term for the first time. Okay, other non-communicable diseases, we have your end organ damage. So what's shown here in the slide is your chronic obstructive pulmonary disease or your COPD and liver disease. Now your COPD, again, as mentioned in the previous slide, is more common with smokers, whereas your liver disease is more associated to alcohol abuse or intake. And of course, last but not the least, okay, is your malignancy. So I've only mentioned some, but there are a lot more cancers that can be prevented by a healthy lifestyle. So these are just the more common ones: lung cancer, breast cancer, colorectal cancer. Now for the communicable disease, this is more related to your sexual behavior component, no? As mentioned, the STIs and of course your HIV/AIDS. Now in summary, or basically to sum it all up, we have the healthy lifestyle 20 health tips given by the WHO in 2020. So basically, the main gist of this is that it's promoting a healthy diet, a healthy amount of physical activity, regular testing, avoidance of alcohol or smoking, and other specific practices such as uh, adequate vaccination, safe sex practices, uh, avoiding mosquito-borne diseases, sneezing and cough etiquette, following traffic laws to avoid car or transport related trauma cases, breastfeeding for babies up to 2 years, of course. Antibiotics should be taken only as prescribed, and you should always wash your hands and prepare your food hygienically and correctly. And if you're feeling down, talk to someone you trust. So that's all for a healthy lifestyle. If you have any questions, you may email me directly via your Canvas, or we can discuss it in person in UERM when you're around. So thank you for listening.